Hello folks, in this video we are going to talk about retinal hemangioblastoma or retinal hemangiomas. This condition may be isolated, just a finding in the retina, or it can be associated with von Hippel-Lindau disease. When associated with von Hippel-Lindau disease, it's a genetic condition where the chromosome 3p has mutations, and therefore patients have tumors, benign vascular tumors, in other organs like the cerebellum or the kidney. Patients with the retinal hemangioblastoma or retinal hemangioma have benign tumors in the retina that are red, elevated, and often leak. It's very common for patients to have multiple tumors, and very often the tumors are progressive, they grow, and they cause several complications in the eye, like macular edema, exudative retinal detachment, or even hemorrhage. Diagnosis of retinal hemangioblastoma is clinical, with fundoscopy, fundus image, OCT, and fluorescein angiography. Unfortunately, especially when associated with von Hippel-Lindau disease, the prognosis is limited or poor. In many cases, patients lose vision. Management of patients with retinal hemangioblastomas will depend on the number of tumors, the location of the tumor, and the progression of the tumor. If a patient has one tumor very small, far from the macula, it can be watched closely. However, most of the cases it's progressive, and patients must be treated with laser photocoagulation or TTT, transpupillary thermotherapy. The goal of the laser is to close the feeding vessel and then the drainage vessel and cause ablation in the tumor itself, ultimately reducing the complications like leakage, exudative detachment, or macular edema. The management with anti-VEGF medicines are possible and adjuvant. In summary, I introduced to you a very threatening condition that can be isolated or genetic and should be watched and managed closely. I hope you enjoyed this video. See you next time.